I am going to be joined today by Isabelle Obert, who is a nutritionist at the clinic. And we are going to be taking questions on IVF, but we're going to focus as well on endometriosis as it is Endometriosis Awareness Week. So it'll be really, really good to take your questions. I've got a lot here for Isabelle when she comes on. So she should be on any minute now. Isabelle.
Hello.
How are you, stranger?
I am very well. How are you?
I'm fine. All going well?
Yeah, no, fine. Still alive,
Oh, brilliant. Thank you so much for coming on today. It's really
That's
good.
okay.
We've got lots and lots of questions. So it's Endometriosis Awareness Month this
Yeah.
month. And we're going to focus on, but we're also going to take questions on IVF as well, because I've had other IVF questions come through. But endometriosis is a horrible disease, isn't it?
Oh,
And it really varies in severity, and some women are completely laid flat by it each month, aren't they, when they have their periods, and so much so that they lose time off work. And it's difficult. And I know it's a real fear for women going through fertility issues, especially IVF,
yeah.
in terms of what they can do to help their endometriosis. So, I mean, there are so many myths, etc., out there. So, I'll start with some questions,
Yeah,
and
yeah, sure.
and you can help. The first question is, how does endometriosis affect fertility? Well, it's varied. Like I've said, there's different stages of endometriosis. It depends on where it is in the body, as to how it will affect your fertility, or whether you'll need to have surgery, etc. So it does affect it on many levels. But having said that, many women go on to get pregnant that do have endometriosis, don't they?
Oh, absolutely. Absolutely. I mean, it can be a problem. I think some of it is a physical thing whereby the extra tissue can sort of obstruct, you
And
know,
bleed at the same time as you're having your period. So,
so,
really painful.
but also it is obviously it's an inflammatory condition, so it's the inflammation in the body. So from a nutritional point of view, absolutely look at reducing inflammation, reducing and estrogen levels as well, helping the body sort of detoxify estrogens more efficiently can help as well.
So when you say inflammatory foods, what do they mean? So somebody's asked here, what food should we avoid eating if we've got endometriosis?
So sort of fairly obvious ones are highly processed foods, very high. So sugar, for instance, is very pro-inflammatory and can increase inflammation in the body. A high intake of saturated fat, such as red meat. Too much red meat can be a problem. Trans fats, which are the hydrogenated fats found in sort of crisps and often sort of very commercially produced pastries and things like that, can be a real problem. Dairy is an interesting one in that generally dairy is recommended to be limited because of the estrogens and potentially the fat, but actually there has also been some evidence that actually dairy can be anti-inflammatory, so that starts to become a personal thing as to whether or not you can tolerate it, or I think more than anything. Gluten is another one as
Yeah,
well.
that's a question that's come up.
Yeah.
Gluten and wheat. Should somebody stop taking gluten or wheat
Yeah.
if they've got
So
endometriosis?
wheat, so wheat contains gluten is a sort of protein, if you like, found in wheat, barley, and rye. Those are the three main gluten-containing grains. So again, it can be an issue. It can be pro-inflammatory. You don't have to be celiac to have a sensitivity to gluten. And I think if you're suffering, it's definitely something that should be looked at. You don't want to just take away huge food sort of groups without maybe making sure that you've got other beneficial whole grains and things, but certainly gluten containing grains would be something to look at, I think.
Yeah, okay, fantastic. Another one here, are there any key foods that can help with the pain? This is a difficult one, isn't it? Because it is incredibly painful. You need medication for that.
Yeah. Yes, well, I mean, there are ways of eating that may help. So hormone balance is an important one, because of course it's an estrogen driven condition, and therefore by balancing your hormones as much as possible, that can help overall. So balancing your blood sugar levels. So if you're eating regularly, omega-3 can be extremely helpful as it's very anti-inflammatory. So increasing things like oily fish,
DHA supplements.
Oh,
sometimes it's hard to get the amount of oil you need from fish, isn't it?
I think it's always hard, actually. And DHA actually has been found to be very anti-inflammatory as it happens. So obviously it's harder for a vegan or a vegetarian, to be honest. So supplement that needs to be taken as well. High fiber foods. Fiber is really important because if you can increase your fiber, it can bind with estrogens and prevent the estrogens. So things like particularly green leafy veg as well, and brassicas actually. So brassicas are things like broccoli and cabbage and sprouts and things, and they contain certain compounds that may be helpful for estrogen clearance too. And melatonin, but in the food, you can get it in foods, of course. So increasing melatonin rich foods can help because it's like an analgesic almost.
And what are rich in melatonin type foods?
Well, sort of some nuts and things are. One of the main things actually is tart cherry juice. You can actually buy tart cherry juice, which is high in melatonin. And magnesium, of course. Magnesium is often deficient in women.
It's a muscle relaxant as well, isn't it?
So
magnesium. So if you're in pain.
Absolutely, really important.
Okay, fantastic. Okay, I stopped eating gluten 3 months ago, and my endo flares have reduced so much. I'm not allergic to gluten. Why could this be? Well, it's what you said earlier, isn't it? It's something
allergic.
Yeah.
And being intolerant can be as a result of leaky gut or very other things, but certainly a sensitivity. And when you are trying for a baby or when you're going for IVF, I think at that moment, the trying to conceive is the most important thing, and anything that you can do which is going to be beneficial and sensible and healthy for you is going to be something to consider. In the long term, one can look at other things as well. But
so, what are the key anti-inflammatory foods that you would suggest? What are the best ones to have?
I think, the other thing as well is lycopene. Lycopene, which is the red sort of pigment, if you like, found in tomatoes. Lycopene has been found to reduce scarring and adhesions in women with endometriosis.
Fantastic. It's very good for sperm as well, isn't it? But
really it's really good for sperm. Yeah, I mean, my big thing is recommending a couple of tablespoons of tomato puree a day with a bit of olive oil or with a bit of of hummus or something like that, which sounds a bit weird, or even a glass of tomato juice. But actually, don't underestimate it. And the problem is just eating the odd tomato here and there. And yes, you're right, the tomato should be cooked, not fresh. Don't underestimate it. That can really help as well, actually. So yeah, cooked tomatoes, oily fish if you're not vegetarian or vegan.
A bit like a Mediterranean type diet, isn't it?
Mediterranean diet. Things like walnuts, so nuts and seeds. Olive oil. I mean, good fats can be really beneficial. It's limiting your sort of processed meats and red meats and things like that. And of course, increasing your green leafy veg, that's really important as well.
One woman's written here that she gets confused about fats, omega-3 and omega-6 and omega-9. So can you explain anything about them?
Yeah, omega-3 is generally found in oily fish. From a dietary perspective, you can find it in walnuts, in flax seeds. I mean, there are traces in various others, but those are the main sources. Generally in oily fish. Okay, that's the main thing. Omega-6 is found in nuts and seeds primarily, but also found in grounds and things, and also, of course, in domestically reared animals. So if you are a meat eater, you will be getting omega-6 in abundance in your diet because they tend to be grain fed. Game and stuff tends to be higher in omega-3 because it's very active and it has naturally higher levels of omega-3. And omega-9, I mean, you can find, there's omega-7 as well. You can find it in things like, some olive oil, of course, avocados, things like that. So,
but they have to be in balance, don't they? You shouldn't have too much of one than the other.
Generally, as you said a bit earlier on, it's harder to get the omega-3, enough of it through the diet. Get through the diet generally quite happily, but omega-3 not so much.
Yeah. Okay. Fantastic. Another question here. I have endometriosis and I'm going through IVF. Is there anything I should be doing differently than if I didn't have endometriosis?
Well, don't forget that once you have started your medication, your hormones are being artificially manipulated anyway. So actually, the endometriosis almost becomes an irrelevance.
Yeah.
Prior to that, obviously, balancing the hormones, what we've spoken about, becomes really important. Once you have started, then I actually think your IVF journey is pretty much the same as anybody else's, except for the fact that, and actually this goes for anybody trying for IVF, we always talk about keeping inflammation down, don't we, Zita? And I think that's
and all roads lead to inflammation, don't they? Lots
Yeah.
of women that are coming to the clinic have got underlying inflammation from underlying medical factors that they have.
Yeah, absolutely. And I think inflammation out of anything is one of the biggest problems we have now anyway. And, you know, anything is linked to inflammation, stress, you know, you name it, you know, there are inflammatory links. And so I think that you can help manage, you know, you can't sort of do everything, but you can certainly help it through diet without a doubt.
Yeah. So women coming through, you know, our clinic, in terms of nutrition is part of our package, isn't it? And it's really, really important. So in terms of preparing for IVF, preparing for frozen embryo transfers, food, supplements, we use a lot of, because, you know, I believe, and I know that you do as well, Isabelle, that it lays the foundations to healthy sperm and healthy eggs. And I know that women are often told they can't do anything to improve their eggs, but I think that the environment the eggs are growing in are reliant on nutrients and food, and there's a lot you can do to influence that, isn't there?
I look, there's never a guarantee for anything, we all know that, but I am absolutely convinced, and we've seen it, you know, that you can improve, you can certainly improve. Improving sperm quality, well, there's plenty of study done on that. You know, it's harder to study the eggs, if you like, 'cause it's pretty invasive to collect an egg from a woman. It wouldn't be very ethical. Exactly. But, you know, I am absolutely convinced that you can improve egg quality. And of course, improving the environment. So blood flow, the better the blood flow, the better the nutrient flow around the body, and that increases the ovaries. And therefore, the better the nutrient sources for the eggs to eat. So, you know, in an IVF cycle, it's the medication job to sorry.
It's okay.
Sorry about that.
That's okay.
It's the medication's job to stimulate the ovaries to mature the eggs. But whilst the medication is doing its job, it's your job to feed them. It's like fertilizing a crop. So it's really important.
It is. So that follicular fluid that surrounds the egg and nourishes the egg, it's been shown to be rich in vitamin D, and vitamin D is very important, isn't it, in terms of IVF?
A lot of women, going back to the endometriosis, a lot of women with endometriosis are deficient in vitamin D. That sensitivity go hand in hand. But actually, as we know, most of us, particularly in winter, are deficient in vitamin D. So it's very important.
And things like inositol, rich in follicular fluid. So it's everything you can do, coenzyme Q10 for the mitochondria, everything you can do to help. But one of the questions we get asked a lot is, like with IVF, it's not a natural process, is it? You know, we want women to produce more than one egg. We want them to get a good crop of eggs. So protein also is important, isn't it?
Absolutely, and exactly that. IVF isn't natural. I tend to look at it as an exaggeration. You know, your body is, it's like ovulating with several eggs. You'd never do that in nature. So it's all very well to get the stimulation right, but you need to then feed the eggs properly. And so protein provides the building blocks for growth. Anything that grows requires protein. So from an egg quality point of view, and yes, the protein, really, really important. But again, you don't want to be eating steaks left, right and center. That's not necessarily the way to go. So and I often, as everybody knows, probably use protein powders. And I often use a whey protein powder, which, by the way, you know, I know it's dairy and there's these big sort of question marks with dairy and endometriosis, but, you know, once you've started your IVF cycle anyway, it's fine. There's generally no problem with that at all.
And how much protein a day should women have, roughly?
Well, I think that when you're actually going through your cycle, obviously it sort of depends on, I mean, how long is a piece of string? How many eggs have you got? If you've got a follicle count of 28, it's going to be different than if you've got a follicle count of 6. But we tend to recommend a rough ballpark figure of 70 to 100 grams of protein a day during your cycle. And spaced out. Not too much all at once, because then it's really difficult for you to digest it, and, you know, you feel very full and all that. So spaced out, but roughly. And it's not an exact science, but I think it's an illustration that your body just fall. I think that's the thing.
No, very, very important. One of the other things that I'm getting asked a lot here is about gut health. And there's so much now about the microbiome, isn't it? Sort of, and gut health. And certainly I know that the key things we look at blood sugar, but we also look at absorption, and the amount of women that have got irritable bowel syndrome, diarrhea, constipation. And when you think that you make you make the hormones from the food you eat. So you've got to be able to absorb those nutrients for eggs and sperm.
Of course.
So it's looking at gut health as well, isn't it?
Very much. And gut health and the microbiome, as you said, is really important as part of the immune system.
Yeah.
Again, poor gut health is linked with inflammation and stuff. Stress, of course, massively affects gut health. And this is the problem. We know you could say, well, why do we see so many people with gut problems? Well, half the women we see, for obvious reasons, are very stressed. And then you have this sort of never-ending vicious circle of suppressing digestive function, which then affects your gut health, which then means that you can't maybe get the food you need properly because your absorption's poor, or your body's reacting to things. It can increase food intolerances and stuff. So we always look at gut health. I think it's very, very important. Yeah.
Yeah. Somebody's asked here, supplements for egg quality. There's a whole range of supplements you can take for fertility and egg health, etc. And I think we've mentioned the vitamin D, the inositol, coenzyme Q10. There's a lot of information out there. A good multivitamin, and folate, not folic acid. Folate is really, really good at being absorbed into the body, much easier than folic acid, isn't it?
Absolutely. Yeah. And we're more women, aren't we, who are having issues with folate absorption anyway. So hence why our products have got folate in, which I think is really important.
No, definitely. So somebody else is asking here about frozen embryo transfer. What food should they be eating for that? And I think what's confusing sometimes, Isabelle, is that one food like pineapple or papaya will be very, very popular, whereas it's a whole broad spectrum, isn't it? And the good thing about frozen embryo, your embryos are already made. So it's just about nurturing yourself. So anything that they should be eating.
Yeah, I think you're right. They've done the hard job. The hard job's been done. Okay, and it's just very much, it's back to inflammation again. Of course, we want to keep inflammation down because you don't want your body in this pro-inflammatory state when you're trying to receive an embryo. So blood flow, uterine blood flow becomes very important. Again, we're back to the omega-3, which can help with uterine blood flow. And so it's basically balancing your blood sugar levels, which helps balance your hormones. It's keeping sort of high saturated fat foods to a minimum. But so fish, if you eat fish, is a great way of doing it. Lots of vegetables. Beta carotene is really important for implantation.
That's all the orange squashes, carrots, everything this time of year.
And the green leafy foods as well.
What about if you're vegan or vegetarian? Because we see, increasingly, I see more women that are vegan. And unless you're really, really disciplined about your food, it's hard to get the protein, isn't it?
It's harder for an IVF cycle, that's for sure. I mean, for not so difficult. Yeah, it's hard. And, the one thing you can't get from a vegan diet, pretty much, everybody's aware, is B12. So, again, it's important to take a good multivitamin. But, yes, no, I think that you have to try harder, but you can get protein through vegan foods. But also I think that you want to watch some of the vegan because, you can have very processed vegan alternatives to protein. And I think, the more you can do through natural, like pulses and nuts and seeds and things like that, is things sprouting your seeds. Yeah. I mean, you have to try harder without a doubt. Try harder.
Yeah, absolutely. Somebody's asking here about CoQ10 for FET. I mean, CoQ10 isn't just, CoQ10 is important for every cell in the body, isn't it? For energy. So it's not going to do you any harm.
No. And it's thought, there is a thinking actually that CoQ10 may help with implantation. What we tend to recommend is if you're taking it as a supplement, I would tend to say stop it at embryo transfer, just because there's been the studies there aren't studies there really of safety in early pregnancy, so we also have to make sure that you're not doing anything that may not be recommended, but taking it right up to embryo transfer is absolutely fine.
Yeah. And some of the things I know that we recommend are things like juices, beetroot juice and things for blood flow, because a lot of women on here have asked as well about womb lining, and very often women get obsessed with their womb lining having to be a certain level or thickness, and women do get pregnant with a smaller womb lining than 10 millimeters or whatever, don't they? We see it happen all the time, and it's hard, but there's not really one food that's going to help that.
No, I mean, beetroot. So beetroot is rich in something called nitrates, which can increase nitric oxide production, which is a vasodilator, which means it's a blood vessel dilator. So it improves blood flow, which means it will get that can really help. Pomegranate juice, be careful. It's okay because of the blood sugars. You have to be a little bit careful.
Yeah, because some of the fruits are high in sugar, aren't they? Even though they are fruit, it's not good to have too much.
No. Watermelon contains something called L-citrulline, which is great for blood flow as well. Nettle tea is good for iron, of course, is good for blood flow. But it's just being careful. It's not overdoing anything, I think. Vitamin E is important for the womb lining. So things like walnuts and almonds and avocados are great for that.
Yeah. Somebody here's just they bought the Zita West IVF prep kit for 3 months. Shall I continue during treatment? Yes, absolutely.
Yes,
really important.
I think that's something that I see a lot of women asking, if now they start stimulation, do they stop their supplements? Absolutely not. If it's supplements that, like in the Zita West IVF pack, so it's specifically for the IVF, or recommended by a nutritionist. The only reason I'm saying that is if people are sort of randomly taking herbs and things, I can't comment on that, but certainly on this, absolutely. And then, you know, you can go down just to multivitamin and omega-3 and vitamin D after embryo transfer, tends to be our recommendation.
Yeah. Somebody's asking here as well, can diet help IVF chances after stage 4 endometriosis removal? Well, the fantastic thing is that you've had surgery, so it's been removed. So you should act just as if you're trying for IVF, preparing all the vitamins and supplements we've mentioned. The diet, anti-inflammatory diet would be really good. Mediterranean diet.
Increase, all the antioxidant rich foods, exactly, all of those things you've just said, Zita, to help egg quality, because it's the eggs are going to be the important bit here.
Yeah, no, absolutely. And it's hard when you've got a low AMH, isn't it? Because a lot of women, get really, really upset and there's a lot more anxiety around when they have a cycle, but you've just got to do the best that you can and see what happens.
Yeah, I don't think, as far as I don't think, I'm sure you'd agree, I don't think that low AMH means that you can't have a successful cycle, you can't get pregnant. I think that several years ago, nobody'd ever heard of AMH, and therefore, and you only know about if you're tested for it. There's lots of people getting pregnant with low AMH. It doesn't necessarily mean
especially if they're younger.
Absolutely. I think as to say, you always treat yourself as if you are trying to optimize egg quality and the environment in which your eggs grow and manage your hormonal balance. Whatever your situation is, then it's a very positive way of thinking that as well.
No, absolutely. Can I have a latte a week? This is a question that women always ask about IVF. So in the lead up to IVF, I think it's really, really good to cut out lots of bad habits for 7 to 10 days, and then build up your nutrients as well. So no alcohol in the lead up. We're talking 4 to 6 weeks here, but certainly the odd cup of coffee is good, isn't it?
It's fine. Don't have it with skimmed milk.
Okay, why not skim milk?
Because studies show the evidence is that women who have full fat dairy have better egg quality than women who have low fat dairy.
Oh yes, of course, that's the Harvard study. Yeah, and that's important because a lot of women choose yogurts, they choose skim milk, they choose everything like that, which is short in iodine as well. And iodine is really important, especially when you get pregnant, for your thyroid, but the baby's thyroid as well.
And egg quality, iodine is really important for egg quality. And also the fats in the milk help slow down the absorption of the sugars from the milk, which helps. So, absolutely. So, but
do you suggest organic milk, full fat organic milk?
Ideally, yes.
Yeah.
Full fat organic milk, or oat milk or almond milk.
No, really, really important. And alcohol, no alcohol in the lead up to IVF. I think it's really good that you cut it out.
I think that obviously when people are trying naturally, we're a bit more moderate, but in the lead up to the IVF, when you're putting yourself, when you're investing so much in very many different ways in something, you want to try and do the best you can. You need to keep sane, but that's one thing that's not so difficult to cut out.
Okay, so one lady's asking about a low AMH at 40, and hers is 14. That's very, very good. But again, that is just one marker. Usually you have a scan, an anti-follicle count scan as well, and you see if it correlates. So it's just one marker. But at 40, you should be, trying as hard as you can to get pregnant. So if you've done it as a fertility MOT and it's good, it doesn't mean to say it will be good in a year or so's time. So you need to sort of be...
are still 40 or
41, absolutely.
And so your AMH may be good, but your eggs are still that age.
But the great thing is when you've got a higher level of AMH and you're older, you've got more to choose from as opposed to having a lower egg. So there'll be some good eggs in there somewhere. Okay. We've talked about the fats. Can supplements help with IVF? We've talked about that as well. Somebody else here is asking, do you notice a higher success rate of after a laparoscopy has been done. I don't know whether you're talking about endometriosis or not, but it depends on the severity, the age, there's other factors as well. It's not just a focus on the endometriosis. What about an AMH of 5.2 at 37? Well, that is quite low, but again, it's in combination with an antral follicle count as well. Because what the doctors want to know is what sort of treatment or what sort of IVF is appropriate for you and what your chances are with a low AMH of being able to get pregnant.
Absolutely.
Or get to the end of an IVF cycle. So these are all sort of important
you
factors.
can't just take one feature of anything, can you?
No, you've got to look at the whole picture. So it's not just about nutrition. We look at acupuncture for blood flow. We look at hypnosis for emotional well-being. It's looking at the whole picture. And I think for so many women, not only are they anxious, but when you are anxious, there's so much at stake, isn't there, when you're going through IVF, that, you know, when you're stressed, when you're anxious, it depletes the body of vital nutrients you need as well, doesn't it? So that makes it really difficult.
Because it's, you know, it's easy for us to say you mustn't get stressed. How on earth can you do that? So it's not about not being stressed, because that becomes an impossibility. It's about managing stress and finding ways to manage it, like the hypnotherapy, like acupuncture well can help, I know. And from a nutritional point of view, we look at supporting adrenal function, making sure that, you know, you're eating the foods that can help support everything, and taking the supplements that may help, so that you're looking at it, you know, as a whole to help move forward, if that makes sense.
And also there are foods that can help with moods, but I think for a lot of women, if their cycle fails, if their period comes, they feel low, and so, you know, you reach for the cake, the bottle of wine, the whole thing, which is okay. Sometimes you have to do that, you know, to get through, but you do feel better if your blood sugar's balanced and you're on a better diet. Somebody's asking here, my AMH is 2.1 and my follicle count is 8. One failed cycle. Any tips for next time? Well, what's difficult about this, I don't know this lady's age, and I don't know what happened in her last cycle, but you've got to do the best you can with supplements, with diet, do whatever you can to help yourself this next time round.
Caffeine is another one, actually, that people often forget, particularly, so obviously for the female as well, but for the male, for the partner, you know, everybody forgets that their partner needs to cut his caffeine down as well. That's really, and look and try and improve his sperm by increasing the antioxidants and all that kind of thing. Of course, I mean, it's not just about that, but that caffeine and alcohol is an area that is often overlooked, you know, in the male, I mean, is overlooked, because obviously
but I do think, Isabel, I think that a little bit of what you fancy does you good. It's very, you know, when somebody is looking to do IVF, they get fixated on, was it because I had that bar of chocolate that it failed, that glass of wine or whatever? You've got to bring some reason into this as well, because that's really important, isn't it?
Completely. Don't try and be too perfect, because it's very stressful, and actually the stress you hold in that you're generating is probably more detrimental than the bar of chocolate, you know, or the latte or whatever that you might be having, just to keep you sane, really.
And also what's hard during COVID, I mean, this last lockdown is so difficult. I mean, it's pouring with rain out there today. It has been lovely over the weekend, and, you know, again, you're just stuck in your own head, aren't you? Thinking, which is difficult as well, overthinking everything. Somebody here's asked about ubiquinol. The bottle says do not exceed 100 milligrams. I think when you've got advice from a nutritionist or whatever, we do use more than that, but it depends on certain conditions, doesn't it?
So ubiquinol is the active form of CoQ10. Not everybody tolerates a lot of CoQ10, and that also needs to be said. So you need advice, and you need to start slowly, but it's always better to get advice. Yes, you're right, and I think it's always better to speak to somebody.
Yeah, no, absolutely. Well, I've got through all of my questions, Isabel. Is there any pearls of wisdom you want to give to these ladies?
Well, I think that, as we've just said, doing the best you can, I think, is really important, whilst being normal as well. And that's the thing. Don't cut everything out. Don't think that you can't do anything that you want to do, that you're sitting there, you know, feeling miserable. But sort of, if you've got sort of, let's say, 3 or 4 things just to focus on, balance your blood sugar levels, so include protein every time you eat. Okay,
Yeah.
that keeps blood sugar more stable. Include colourful foods every time you eat, because you can't overdose on antioxidants. Try and eat rainbow colours. So
Yeah.
really, really important. And lots of particularly green leafy veg and more veg than fruit. And, you know, limit your sort of caffeine and your alcohol intake. Obviously, for that, we've discussed about what we do for IVF, but in general, and I think just relaxing a bit of chocolate, you know what, is fine. Have it after dinner. Don't have it in the middle of the afternoon, and have dark chocolate. You know, there's good things that you can do.
Yeah, and some questions coming up as well about taking supplements. Don't take them all together. Try and space them out throughout the day. A lot of women think they're taking, you know, they take it all at once, but if you can spread it out throughout the day, that's better as well.
If you're starting to take a load of supplements, I would always start slowly.
Yeah.
Start
and
slowly.
build up.
Build up. Exactly.
Yeah.
Exactly.
Okay.
But
Isabel, thank you so much. So good of you to come on today, and I hope you'll come on again. And thank you all for listening. Sorry?
We might see each other in person one of these.
Oh, God, I hope so. I hope so. Thank you all for listening, and I will be back next week with more IGTVs, and so I hope you join me then, and I'll post what we're doing. And this will be posted on my IGTV, but also on the clinic's IGTV as well. So I hope that helped you. Okay, lovely to see you all. Speak to you soon. Bye-bye.
Bye.
Bye-bye.